Good morning, Malia. City of Toronto calling. Can you hear us? You'll need to unmute yourself.
Yes, good morning. I can hear you.
Hi. Where are you from, Malia?
City News Toronto.
Okay, great. Thanks so much. Do you have a question today, by the way?
Not right now, no.
Okay, if you do, you can either send us a chat or just put your hand up.
Okay, thanks.
Great, thank you.
Good morning and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, December 30th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, good morning. I know the Christmas that many of us just celebrated was a different Christmas than in years past, but it was what we had to do in order to ensure that we have a better 2021. The threat of COVID-19 remains very real. That is evidenced by the record high daily number of new cases reported yesterday and again today, as Dr. Davila will outline. Since our last update, just before Christmas, more than 4,200 people in our City of Toronto alone have tested positive for this virus, and in the 6 days from Christmas Eve to today, 78 people have tragically died right here in the City of Toronto due to COVID-19. Imagine losing a loved one at Christmas. 78 families in Toronto had to endure that this year, and we extend condolences to all of those grieving families. We are still far from gaining the upper hand with this deadly virus, and we have another chance to show how much better we can do at following public health advice with the upcoming New Year's Eve and the weekend to follow. Thank you to the residents who did the right thing and stayed home this Christmas and are continuing to stay home as much as possible this week and over the coming weeks. But the bottom line isn't as happy. We, as individual residents of the city and as families and friends of one another, we simply have to do better. Special thanks are due to our frontline and essential workers, many of whom worked for us and with us and supporting us over the holidays. Whether it's our healthcare, grocery store, pharmacy, delivery, factory, personal support, TTC, winter operations workers, or whether it's paramedics, firefighters, police officers, and many more, all of them have been completely dedicated throughout this pandemic, and we're forever grateful for that commitment and continued service on their part. We know how hard our frontline and essential workers are working during the pandemic, and we know we need to help support them through these challenging times. And so, as we did earlier in the pandemic, for this lockdown, we'll be providing emergency childcare for the children of essential workers during the provincially mandated remote learning period from January 4th to January the 8th. In addition to community childcare centres approved by the province, 3 of the city's childcare centres, along with the city's home childcare agency, have submitted applications to the province to provide these services to eligible essential workers during this time. They include the Shoreham, O'Connor Satellite, and Taylor Creek Early Learning and Childcare Centres. The city's provided emergency childcare to essential workers from almost the very beginning of this pandemic because we knew this was the right thing for us to do. I encourage Toronto residents who are essential workers themselves and who find themselves without childcare for their school-aged children to see whether they are eligible for this service. If they are, they can contact the childcare provider listed on the province's list of approved emergency childcare providers once it's available later this week. We're also working to make sure that students still have access to nutritious food during the lockdown period. The city is the largest funder of student nutrition programs supported by Toronto Public Health. This year alone, we budgeted over $16 million for student nutrition programs for those who need help ensuring that they have a healthy, nutritious diet. These meal and snack programs mainly operate in Toronto Public Schools across 609 different locations and provide meals to more than 209,000 students when schools are in the regular fashion. The Board of Health voted this month to give permission to our student nutrition partners to use those funds as needed to support the purchase of nutritious food for students who are learning remotely. Program funds can now be used to support those families in need, which count among them remote student learners who normally attend a school with a student nutrition program. So this support, for example, could include stocking community pantries, or extending grab-and-go programs, or reinitiating Food for Kids, a program that distributed grocery food gift cards begun at the start of the pandemic. We've notified these partners of this change, and we hope that they will work to implement this more flexible kind of arrangement quickly and as needed as the pandemic continues. This is one more way in which the City of Toronto is working to do everything that it can as a municipal government to adapt to this crisis in real time in order to help those people who need the most help. Tomorrow's New Year's Eve, and typically we all get ready for some exciting festivities here at City Hall and in Nathan Phillips Square. This year, like a majority of our holidays, celebrations will have to be different, and sadly, in line with public health advice, there will be no celebration in Nathan Phillips Square. We're encouraging people to please stay home, do not go to house parties or host house parties involving people that you don't live with. Surely, the thousands of new cases and dozens of deaths in recent days will convince even the most enthusiastic New Year's Eve partier that the price to be paid for that partying just isn't worth it for anyone. We must make 2021 a better year, and it starts with how we handle the next holiday marking the beginning of that new year, starting tomorrow night with New Year's Eve and New Year's Day itself and the weekend to follow. Stick strictly with ringing in the new year with your household and virtually with friends and family. And most importantly, also, please do not drink and drive. Please just stay home. This will be the test of whether we can be disciplined enough to post better numbers in the first few weeks of reports that we get in 2021. To help keep you in front of a screen at home, we've worked to provide a New Year's celebration that everyone can access online. I'm pleased to announce that the City of Toronto is collaborating with the CN Tower and Chum 1045 to host a virtual New Year's Eve countdown and light show. This celebration will be a safe alternative for residents who want to say goodbye, or maybe in some cases good riddance, to 2020 and welcome in 2021. I'll be there virtually as well to do the actual countdown, and will be joined by some of our remarkable frontline workers who are our everyday heroes and have been throughout this pandemic. I would like to send my thanks to the staff from Kipling Acres and Canadian Head Injury Resource Services who will be joining me for the countdown to 2021. The show will be live streamed on the city's YouTube channel and simulcast on Jamar's House Party live on Chum 1045 on December 31st, starting at 11:58 p.m. The CN Tower is one of the landmarks of our city, if not the landmark of our city, and has become a symbol of pride for all Canadians. And it will shine bright on New Year's Eve with a spectacular light show featured also in TVO's New Year's Eve event from Ontario with Love. That's on TVO. It's called A Celebration of Hope. That 90-minute event, featuring incredible performances, storytelling, and fireworks, will start at 10:30 in the evening on TVO, the TVO YouTube channel, and at thestar.com. As we approach the new year, I do want to take the time to thank those who played a big role in moving our efforts forward and helping us spread the message via our daily COVID-19 media briefings. These briefings would not be possible, especially in a lockdown environment, without the hard work and dedication of staff who are behind the scenes, managing the logistics of ensuring that myself, Dr. Davila, Chief Pegg, and members of our public service team can speak directly to all of you and to try to answer as many questions as to what's going on as we possibly can. I'd like to take the time to properly thank everyone who's been part of these media briefings as we reach the end of the year. A special thanks go to Global News and Chris Dunseith, who has been here throughout the pandemic to broadcast our briefings for all of the media outlets. Thank you to all of the reporters who have worked diligently to cover these updates and to ask questions on behalf of their viewers and readers and listeners and all Toronto residents. The work that the media does is a public service. It has helped us to raise awareness around the public health guidelines and the numbers and the progress and services and the different programs that are available and ensure that we remain accountable to you during this emergency. To our City AV and broadcast team, Craig Adams, Paul Lee, Markham Einherson, Nick San Juan, and Mike McGuckin, also many thanks. As well to Brad Ross for moderating these media briefings and to his entire team, which has supported us through all the different briefings. You know, whether it's Cafe TO, Active TO, Shop Here, Digital Main Street, the COVID Equity Action Plan, and all of the continuing day-to-day and emergency services that have been kept going by the city throughout, none of this would be possible without our city staff, who continue to answer the call during the pandemic and then some, and who also deserve our sincere thanks. And the core team here, if I can call it that, the core team that's come to all these briefings, which is Dr. Davila, of course, as our Chief Medical Officer of Health, Chief Pegg, and Board of Health Chair Joe Cressy, who's been working very closely with us. We have worked as a team, and we've tried our best at all times to do the right thing. To our interpreters, who have had to put up with, certainly me as a fast talker, and I'm not sure about the others, I'm probably the worst offender, but Sarah Stadnicki and Glenda Messier and the team at Canadian Hearing Services help make sure that we can get the word out to everybody. And I want to make sure that, we thank everybody from one end of the city to the other who are the residents who have helped to make this a team effort. You know, we still have some work to do, but it has been a team effort to get us to the stage where we have done better than we might have done had it not been for the team effort that everybody's put in. This has been a tough year, the year just coming to an end, 2020, for people all around the world. But I'm hopeful that 2021 will be better. Sometimes I say that it couldn't be much worse, but I'm hopeful that it actually will be better. This city has the right stuff, and it has the right people to beat this thing. Every single thing that made Toronto the envy of the world is still here. Most of all, that caring about our city and that caring about each other, which will be the key elements in making sure that we govern ourselves accordingly in the coming days. Caring about each other and caring about our city means following public health advice, staying home, wearing masks, avoiding crowd scenes, only being with people that we live with. Things will get better because we have a vaccine and because we're working at the city to make sure that we're ready to support the provincial vaccination efforts when it comes time for the general public to get vaccinated. But things need to get better even before that. And I know that especially over the New Year's period, we have the will and we have the ability to make that happen. While I will have a more formal New Year's message on Friday, may I take this opportunity to wish each and every person who is resident in the City of Toronto and those beyond who see these briefings a very happy New Year, a better New Year, a healthier New Year, one that I know holds out great hope and can bring great promise, and we just have to get through a continuing difficult period in the meantime. I'd now like to ask Dr. Davila to provide her report for today.
Thank you, Mayor Tory, and good morning. Today, I am reporting 1,069 new cases of COVID-19 in Toronto. More than half are between the ages of 20 and 49. 345 people are in hospital. We've seen a 55% increase in the 7-day moving average for hospitalizations since November the 8th. 92 people are in the ICU. And sadly, 4 people have died. Today's case count figure is a record high for the 2nd day in a row. Today is the 4th record high this month, following 957 cases yesterday and earlier record highs announced on December 16th and December the 1st. Toronto's case count since the start of the pandemic now exceeds 60,000. The level of infection is such that every neighborhood in Toronto meets the province's criteria for red zone designation. In the most recent data, from December 14th to the 20th, 21% of our respondents to our online case survey reported gathering in a private home and with people who weren't members of their household. Our fear is these results, in fact, underestimate the degree to which people were mixing over the holidays. I last reported to you in person on December 23rd. There have been 4,252 cases in the 7 days since. While it is now 5 days since Christmas Day, I'm not convinced that these cases are connected to it. Cases are generally confirmed many days after infection. We estimate usually between 1 to 2 weeks following. In this context, I have 3 key points to make. First, it is now reasonable that we should brace for an extended period of potentially unsettling and discouraging numbers in terms of COVID-19 infections in Toronto. Second, early next week, Toronto Public Health will announce additional actions meant to reduce risk associated with COVID-19 in workplaces. These steps by Toronto Public Health are meant to create as much distance and safety as possible, while respecting many people need to work and many businesses are rightly permitted to continue operations in order to provide the goods and services we all need in daily life. Thirdly, for all of us, we have no choice but to resolve to keep apart as much as possible to limit further spread at these levels or at any level. It is possible, but it requires resolve, patience, and belief. We can make the virus level decline. Right now, that may seem hard to believe. The news during the holidays has focused on 2 stories: vaccines and the variants of the COVID-19 virus that have emerged elsewhere in the world and are now being identified in many countries, including ours. Viruses are always changing. While we take nothing for granted, the scientific and medical communities anticipate changes in the structure of a virus and its ability to spread. Science also has important insights into COVID-19. The indications are that the vaccines, as developed, will remain effective against the virus, or that if it somehow becomes necessary to adapt the vaccines, that can be done. Now is the time to focus on steps for our own self-protection and the protection of others, because the risks around us are escalating. The next several months cannot be seen as just the stretch of time between vaccine trial results and needles in arms, or a period just to be waited out until it's our turn for the shot. We must be active. We must be vigilant, determined, and patient while we wait our turn. I urge you to double down on keeping apart, keeping a safe distance, and wearing your mask every time you can. Most critically, go only where you need to. This has 2 benefits. First, it keeps you apart. When you are apart, you face the least amount of risk. Second, it protects others, because there are always people who have no choice. They have to be out. But when you can stay home, do. The fewer people we have mixing at this point is perhaps the most important defense against COVID-19 that's under our control. We will need to believe that we can change things and act like it in the next few weeks, particularly if we have to get through a period of discouraging case counts. We should prepare for those numbers. We should act to make certain that they will come down. It is our only choice, and it is never too late to make it. In all of us lies the capacity to begin turning these numbers around. It isn't impossible, and it won't be easy. We need to be clear on that as we enter the new year. However, it can be done, and we can do it. It isn't a question of if. We can. But we have to earn this one. I wish all of you good things in 2021. Please be active, vigilant, determined, and patient, and let us unite to put COVID-19 behind us. With that, I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good morning. The enforcement of public health-related regulations has been a top priority for the City of Toronto since the outset of COVID-19. Our coordinated enforcement teams have been working diligently to enforce the regulations relating to COVID-19. The City has taken formal enforcement action 1,795 times to date in response. Since our last update, our enforcement officers have continued to monitor compliance with the Reopening Ontario Act. As a result of violations of the Reopening Ontario Act, 33 charges were laid and 21 notices were issued against owners and operators of entertainment establishments, personal service settings, a badminton centre, restaurants, bars, and retail stores. Additionally, 13 charges were laid and 93 notices of violation were issued as a result of large gatherings on private property. This included a liquor establishment, a rental property, a gaming house, and gatherings on private property and inside private residences. Toronto Police also responded to a protest, resulting in one charge being laid. Unfortunately, we continue to experience issues with respect to the use of outdoor ice rinks after hours. In response, we have increased the number of paid duty police officers and corporate security personnel assigned to outdoor rinks to assist in preventing issues and protecting health and safety. Toronto police officers were engaged and assisted in dealing with these issues, resulting in 19 charges being laid under the Trespass to Property Act. We are also responding to issues and concerns relating to the use of closed ski and snowboard hills for various activities, including tobogganing. While we continue to do all we can to support safe outdoor activities, the use of closed ski and snowboard hills poses a significant risk of injury. Our municipal licensing and standards team is working in collaboration with our Parks, Forestry and Recreation team on addressing these concerns. For a list of designated tobogganing hills, please access toronto.ca for the most up-to-date information. Amidst all of the difficulty and challenges associated with the restrictions that have been put in place in response to COVID-19, it is important to remember that we continue to be hard at work, preparing for the launch of the COVID-19 mass immunization campaign. Along with our essential and critical frontline service workers, our immunization task force worked through the holidays and continues to work every day to ensure that we are ready to launch mass immunization clinics as soon as vaccines are made available to us by the province of Ontario. Our goal is clear: to be ready to go as soon as the province of Ontario is able to provide the City of Toronto with vaccine for local administration. As I close, I would like to extend my sincere thanks to each and every resident and business owner who has given so much this year. The impacts on our city are unparalleled and have impacted us all deeply. I would also like to acknowledge and thank each of our city divisions, agencies, and corporations for their tireless service in response to the COVID-19 pandemic. It still seems surreal to report that today marks the 295th continuous day of Emergency Operations Centre activation. This has been a year like no other, yet I remain confident that we will get through this together. I wish each of you a happy, healthy, and safe new year, and all the very best for 2021 as we all put COVID-19 behind us once and for all. Thank you.
Thank you, Chief Pegg. We have a number of senior staff on the line should you have specific questions. And to our reporter friends, please remember to unmute yourself before asking your question. And first, we'll go to Lucas Meyer from News Talk 1010. Hi, Lucas.
Oh, hi there. Thanks so much for taking my question. I hope you're all safe and have a happy new year. I'm sure my colleagues will have many questions about the numbers, but Mayor Tory, I just want to follow up on your comments this morning about Minister Phillips calling it a mistake. Wondering if your personal feelings might be affecting you here. Would you not be really angry to learn that a counselor defied public health advice by yourself and Dr. Davila and just went off on vacation and didn't tell anyone?
Minister Phillips made a mistake, a serious mistake. He's been chastised by the Premier for that. He has admitted his own deep regret at making that mistake. I have acknowledged that it was a mistake. It's a very regrettable series of events. But I think people who know me also know that, you know, I especially stand by my friends when they make mistakes and when they're in trouble, because I just think that you have to do that. It's not about the actions, it's about the person. He's a human being. And he made a mistake, and he'll pay a price for that. But I think, you know, now it's in the Premier's hands, and he'll deal with it. He and Mr. Phillips will deal with it as they see fit.
I understand that, Mayor, but it seems to be a lot more than a mistake when there was this level of deception, appears to be, some would argue, deception around the fact that he apparently didn't tell anyone. And so on a larger picture here, you also said you don't want this to diminish the fight against the pandemic, which obviously nobody wants. But do you not think that levels of government are losing control in messaging leading up to the holidays with the numbers that Dr. Davila just mentioned? And that this trip does undermine what little or some confidence that the public has left in their public figures.
One of the reasons that I said the mistake was very regrettable is because it does, you know, go against all the messaging that we've been trying to get out there with respect to people and their activities, and people expect of their leaders that they will, you know, govern themselves accordingly in line with their own advice. So that's why it's such a regrettable mistake, but it's a mistake that human beings make, and you know, he's been severely chastised for that. He's expressed his extreme regret at that mistake, and I don't know what I can add to that. I'm not really aware of all the different facts that you allude to with respect to what else went on surrounding all this, other than there was a big mistake made, and a big price is you know, is going to be paid for that in terms of his own credibility. He knows that.
Thank you. We'll go next to Austin Delaney from CTV News. Go ahead, Austin.
Dr. Davila, I'd like a reaction to Mr. Phillips being away. What are your thoughts on that?
Well, I think the mayor has summed it up nicely, and I would say this, right? In the annals of medicine, and frankly within my own clinical practice, and in that of the practice of many other physicians that I've had the honor and privilege of working with and knowing over the many years of my own practice, it's not the first time that a patient hasn't followed the advice of their clinician or their advisor. I would say this, though. It is really, really important at this time. And we know that we're going to see more discouraging numbers, as I've said. We should expect to see more discouraging numbers over the next several weeks or so. And all the more reason for us to really double down, as I said, to be very vigilant about following and adopting those measures for self-protection that we all know so well. But fundamentally, what it comes down to is staying home as much as possible, limiting that interaction with anybody else outside of your own direct household to the greatest extent possible, recognizing that there are people who must work outside the home, all those who are providing essential services, including our healthcare colleagues. They need to continue to be there providing their necessary and fundamental service. And the best way we can support them so that they are there to help take care of us is for all of us to stay home as much as possible.
Austin, if you have a follow-up, you'll need to unmute.
A follow-up, thank you. To the doctor as well, and also to Mayor Tory, the AstraZeneca vaccine that's been approved in the UK, 70% effective. If and when it comes here, and they're talking it's a game changer in the UK. Is it that here as well?
So why don't I start off with that, Austin? I think vaccines in general are game changers. Certainly very excited to hear about yet another vaccine being approved in the UK, albeit. I understand that this vaccine is also going to be looked at by Health Canada officials. We'll look forward to hearing what their review provides and some approval, hopefully, at some point in the not too distant future from them. But I think that there's a lot of promise with respect to vaccines. The issue, of course, is what can we do at this time until it is our turn to receive our vaccines? And you know what that is. It's going to be about staying home as much as possible, really watching distance, wearing masks whenever you can, as much as you can if you have to be outside of your home. And washing your hands. Again, all these good practices are the best things that we can do to protect ourselves, to protect others around us, and see us through to the time that we can actually get those vaccines out there and administered to all of us.
I will only say to you, I think we have two jobs to do. The first is to get to the day on which that vaccine and all the other ones are available to us in adequate supply, and that is in the hands of the other governments, and we're looking forward to having that supply as soon as possible. And secondly, is the minute it's here to be ready. And Chief Pegg has been heading up an immunization task force, which met yesterday, to update on its progress in putting those arrangements in place. And I will just say a lot of hard work is being done to make sure the City of Toronto will be ready to play its part under the ultimate rules set by the province and the federal government when the time comes, which hopefully will be as soon as possible. But in the meantime, as Dr. DeVilla said, and as we've all said here today, we have our own work cut out for us, leaving the vaccines to one side to make sure that we get there with the numbers beginning to improve absent a vaccine. And I think we can do that if we stay home and wear masks and avoid crowd scenes, avoid entertaining people that are not living with us. These are the things that we have to do to get the thing, to keep it in hand while we wait for these vaccines to be available to us.
Thank you. We'll go next to Christina Tenalia from CP24. Go ahead, Christina.
Hi, everyone. Good morning. Dr. DeVilla, you just mentioned that people here in this city that it's reasonable that we should brace for an extended period of unsettling numbers. In saying that, how long should the current lockdown last? Not only the province-wide lockdown, but the one currently, of course, in the City of Toronto, which began before the province-wide lockdown.
Hi. Austin.
So,
hey, how are you? Oh, I'm okay.
Sorry, just 1 second. Can you just mute Austin? Thank you. Sorry, go ahead, Doctor.
Sorry, Christina. So you were asking questions around how long current restrictions should be in place, and I think that those decisions need to be made as we see what actually happens in respect of case counts and what sort of impact we have with the restrictions in place. That has been our practice all the way through the entire course of the pandemic. Observing what actually happens on the ground, understanding what our situation is, what our epidemiology looks like, and making reasonable decisions premised on those data. So that I think you can count on for the rest of the pandemic and in the weeks and months to come. We will continue to provide you with the data as they become available, adjust our actions in accordance with those data, and make sure that we're informing you as to what actions we're taking and why. And give you our best sense as to what kind of impact we're seeing those actions and restrictions are having.
My next question is for Chief Pegg. Chief Pegg, yesterday, General Hillier mentioned that he has chatted with you, of course, and it was just noted that you were part of a meeting on the vaccination rollout yesterday. A few questions, if you could give us, frankly, just to be fair to my colleagues, a bit of insight as to the rollout in Toronto. When we look at mass vaccination sites, are we talking about more, mass vaccination sites or pop-up sites located in priority neighborhoods? Is the focus going to be people making an appointment at their pharmacy or at their doctor's office? And on that note, the federal government is hoping to start vaccinating Canadians in April, but General Hillier says mainstream Ontario won't be able to receive the vaccination until July. Is there a chance that could move up?
Sure. So a couple of questions there. I'll do my best. First and foremost, the goal and in fact the single objective of our immunization task force is to make sure that we are ready to begin administering vaccines, to put in needles in arms, so to speak, without any delay and immediately upon vaccine being made available to us by the province of Ontario. As you've heard General Hillier say a number of times now, the actual timelines with respect to the availability and the delivery of those vaccines is still fluid. And at this point in time, we have not received any specific confirmation or any confirmation whatsoever, actually, with respect to when that will be. Having said that, we have been planning now since November. There is a very dedicated and robust team that has been working nonstop on ensuring that our plans are in place. Our plans, at some point, I expect in the near future, we'll be able to provide some additional detail and give you the construct of what this looks like. But at this point, suffice it to say that we are developing a plan that will include a number of distribution methodologies, and that will undoubtedly include distribution or actual administration sites. There will be mobile capacity. There will be priority neighborhood deployment and prioritization. So a number of things are being planned. It is a very complex operation, but one that I would say is well in hand. And I'm very, very proud of the fact that our task force continues to work as hard as they are and continues to really stay ahead of this curve. I am in regular contact with General Hillier. In fact, he and I spoke specifically with respect to immunization task force planning on Christmas Day and on Boxing Day, and every day since, including this morning. And immediately prior to this press conference, I was involved in meetings with the province. So very much ongoing. We are in a good place, and as I say, as those plans firm up and as we get more concrete and more firm details from the province, we'll be in a position to provide you with a more comprehensive picture as to what the rollout will look like in our city.
Okay, thank you. We'll go next to John Chidley-Hill from the Canadian Press. Go ahead, John.
Good morning and Happy New Year to all three of you. My first question is for Dr. Davila. Doctor, you're speaking about another surge in numbers, and I'm curious, what is Toronto Public Health doing in terms of bracing for that surge, in terms of staffing, maybe reorganizing of hospital wards, even creation of field hospitals?
So, John, first and foremost, when it comes to healthcare services and healthcare provision, things like hospitals and clinical care, that's actually within the provincial jurisdiction, as is all of healthcare per se. When it comes to public health, what we have been doing here at Toronto Public Health since the beginning of the pandemic, and we will continue to do this throughout the course of the pandemic, is adjust our resources to the changing circumstances as we see them. So there is a constant assessment of what we're doing, whether there are opportunities for greater efficiencies, resources that can be put from one place of the organization or one part of the organization to another with changing circumstances. And I'm sure that this happens within healthcare as well, although that's not within our jurisdiction. This is just, I think, good, responsible practice in terms of running an organization and responding to a rapidly evolving situation such as the pandemic has presented over the course of almost the last year now.
And I guess this question is really for all three of you. How frustrating is it that the numbers continue to surge, and it seems like there's at least one segment of the city, one segment of the population that has ignored requests to stay home and to stay isolated and to avoid public gatherings?
So perhaps why don't I start with that? You know, there's no question that, of course, certainly from my perspective as a public health physician and as the medical officer for the city, it is frustrating, and it pains me to see this much level of virus transmission in our city, especially when I know that it is preventable. There is much that is within our control. But I think that's exactly the point. And in the realm of public health, and I would say in the realm of medicine writ large, one has to always maintain a sense of hope and optimism. You know, as I mentioned earlier, it's not infrequent that patients don't always follow the advice exactly as it's given. But that's not the time to give up hope, and it's never the time to give up on a patient. So I never give up on the 3 million residents of Toronto who I consider to be my patients. I have a great deal of hope and a great deal of optimism around what the people of Toronto can do. And in fact, we have evidence of that. We saw what we were able to do in the spring. We were able to really control virus transmission through our concerted actions together as a city. So I continue to ask the residents of Toronto, let's do it again. We can do this. We've done it before. We know we can do it. So I look at it ultimately with a sense of hope and optimism, particularly as we approach the new year. I'll turn it over to the mayor and to the chief if they have anything further.
I just want to underline the words that Dr. Davila just spoke, and to say something that I've learned from her and from her team in the analysis they provide to us, which is that there may be people across the city who think somehow this is not their problem or it's not happening in their area, and Dr. Davila pointed out this morning, there isn't one neighborhood in the entire city of Toronto that isn't in what would be described as the red zone based on the provincial numbers. So this is a problem across the city. Therefore, it's going to require a solution or an approach taken by everybody across the city. And it's clear that the level of activity that was so diminished in the spring, where people did stay home and the streets were emptier and there were fewer people out and about, and it's clear to us that those levels measured by, for example, the phone data as to people's phones that were staying at home during that time are not staying home to the same extent now. So we have a chance. We have a really good chance on New Year's Eve, New Year's Day, and over the weekend and beyond during this lockdown period, which is miserable for a lot of people, including businesses, to show that we can do what we already showed we can do in the spring. And I just think it's going to be best if we do, and by the time we get through the lockdown period, we'll be getting very close to the time on which the vaccines likely will be available, and that starts a new chapter. It doesn't mean we have to stop disciplining ourselves, but it starts a new chapter of hope. But in the meantime, we are the ones that have to make it better for ourselves, as we did in the spring. We've done it before.
Not a lot that I really need to offer. I obviously echo the comments of both the mayor and Dr. Davila, other than to say that throughout this pandemic, we have worked hard to educate our residents on how to protect themselves from the spread of COVID-19. We have worked hard to take reasonable and necessary enforcement action to protect public health and safety. And all of that has been the result of one unwavering goal, and that has been to save lives and to do everything that we can do to prevent the spread of COVID-19 in our city. And now we find ourselves in the spot where we are continuing to work tirelessly in order to get us to the day where we are able to see the citywide, wide-scale administration of COVID-19 vaccine. And perhaps all I can add would be just another request that I appreciate that people are frustrated and they're tired, and I admit I don't even know that I understand the depth to which people have been impacted and businesses have been impacted. But don't give up. We are close. There is a light on the horizon. That light is in the form of COVID-19 vaccine, and we are going to get there. And the very moment that those vaccines are available for us in the City of Toronto, we will make sure that we are ready to administer them for the purposes of putting this all behind us.
Thank you. We'll go next to May Warren from the Toronto Star. Go ahead, May.
Yeah, thank you for taking my question. Dr. Davila, yesterday, Dr. Yaffe said at the provincial presser that some of the bump in the cases might be due to pre-Christmas shopping trips in Toronto. Can you just explain exactly what she was referring to there?
So May, unfortunately, I can't comment on what data Dr. Yaffe might have been referring to, because I'm not sure what data she was referring to. I did allude in my remarks to data that we have based on our survey, an online survey that we do of our cases, and we know that for 21% of the respondents, that they talked about gatherings and participating in gatherings in people's homes, in private homes, along with others with whom they don't actually share a roof, right? People that they don't live with. So we know that certainly social interactions and interactions with others in general are the source or is a major source and risk factor for ongoing COVID-19 transmission. But that just emphasizes again and again why it's so important for people to limit their social interactions to the greatest extent possible. And the best way to do that is to stay home and only really interact with people with whom you live. So again, I can't emphasize that message enough, and that certainly has been borne out by the most recent data that we have, which, as I mentioned earlier this morning, is from the period December 14th to December the 20th.
Okay, thank you. And just the second question is, with the numbers so high right now, why wait until next week for the new workplace measures? And is it time to look at, other stricter restrictions like a curfew or something, for example, with the new record of cases today?
Well, May, I would say this: we're constantly looking at our data, constantly assessing our situation and making the best decisions that we can in light of those data and with the evidence and our own experience from the spring and from earlier this fall, trying to understand what are the best measures that we can take and how can we do that in a method that balances out all the necessary factors that need to be balanced. That's no different with the upcoming actions that I spoke to today around reducing risk within the context of workplaces. So we know that in order to provide all of us with the goods and services that we need, right, for our daily lives, there are going to be a number of workplaces that are going to have to continue to operate. So this remains one area, and an important one, where people actually have the opportunity to interact, and therefore, through that interaction, it gives rise to COVID-19 risk. So we see that as a very responsible area in which we should engage further in order to reduce risk there. And you will see us, as Toronto Public Health, continue to engage and continue to either implement or advocate for actions premised on the data as we see them and premised on the evidence that we are able to understand and ascertain will make a difference in terms of controlling COVID-19 risk.
Thank you. We'll go next to, Nick Poivert from CBC News. Nick, go ahead.
Hi, thanks, and Happy New Year, everyone. For Dr. Davila, just wondering if you're expecting that cases are probably going to keep rising over the next little while. We're going to have kids going back to childcare next week across the city, a lot more kids the week after going back to elementary schools. Is that appropriate? Is that smart if what you're expecting does happen and we are seeing new record cases into the next few days?
Well, Nick, as I've said on a number of occasions, I think we have to make the best decisions premised on the data that we have at the time. And we know that childcare is an incredibly important service. It's one that allows for many of those essential services to continue to be provided. And I would say this: we have also had great success, I would say, in managing to provide throughout the system and throughout the city safe childcare despite the pandemic all around us. I would also say this in respect of schools. There has been an incredible amount of work that has gone into creating environments that are as safe as possible within our educational settings in order to allow for children to continue to derive the benefits of attending school in person. And it is about more than just academics, as you've heard me say on a number of occasions. There are many health benefits over and above the delivery of education that are associated with in-person attendance at schools. So as with every decision that we've taken over the course of this pandemic and every bit of advice that we've provided, because not all of these issues are exclusively within our purview. So for those where we've provided advice or those where we've taken the decision, we are constantly looking at the data and trying to provide the best way forward, the best way that balances out all the risks and benefits, being very mindful of, yes, controlling COVID-19, but also recognizing that health is about more than just controlling COVID-19.
Thanks. And just to follow up, sort of a broad question on enforcement that maybe Chief Pegg and maybe Dr. Davila could answer as well. Is there a point that, cracking down on private gatherings or these other kinds of parties could become just too difficult to sort of manage and to actually implement in a way that reduces cases if the numbers get so high in the city? Is there a point that becomes maybe not the best use of resources for the city?
I would say that throughout the response to the pandemic and throughout our coordinated enforcement efforts, we have done our very best to obviously receive complaints on an intake basis, to prioritize them, and then to respond to them on that prioritized basis, such that the highest risk incidents are the ones that are receiving our response and our priority attention first. I don't see that changing, but you make an interesting point, and I think the point, and we've heard Mayor Tory say this many times, that we would never, frankly, we would never want to have enough resources to be able to be inside, if you will, or be policing the insides of people's homes. There is a role for enforcement to play, there has been a role for education to play, and there's a role for each of us to play. And that role on an individual basis is for us to make the decisions and make the choices that protect safety, that prevent the spread of COVID-19. And unfortunately for us right now, that means making choices that include not socializing with people that you don't live with, not hosting gatherings, not attending gatherings that someone else chooses to host, and to stay home as much as physically possible. So at this point in time, we have no plans to amend our enforcement strategy. We will continue our coordinated enforcement teams, obviously with municipal licensing and standards, Toronto Public Health and Toronto Police. We'll continue to respond to prioritized requests as they happen. Dr. Davila?
I think the only further comment I would add to that, and I've already said this, and has the mayor as well, he has also remarked on this. I think when we look back at our experience over the course of this entire pandemic, we've done this before. We have actually successfully managed to reduce the spread and transmission of COVID-19 in our community. And we've done so without necessarily deploying a very heavy hand. So, I look to the residents of Toronto to do their part, once again, as we know they can, because they've done it before. So it is within the realm of possibility. We can absolutely do this. So, stay home as much as possible, limit your social interactions such that you really are only interacting with those with whom you live. It is temporary, it is difficult, but it is doable, and it's what's needed at this time.
Okay, we'll go next to Jason Chapman from AM 640. Jason, go ahead.
Thanks, Fred. Mayor Tory, the question's for you. Since you were asked earlier in the news conference about Minister Phillips, you used the words that he made a mistake, and that's why you're forgiving him, and everybody makes mistakes. But I'm watching in real time, Mayor Tory, the reaction roll in. People are saying that it's not that he made the mistake, it's that he tried to cover it up. It's that he used social media to make it look like he was here. And the comments are very clear, Mayor Tory, that everybody else made the sacrifices that the minister asked us to make and looked like he was making. So it's not that he made a mistake, it's that he lied about it. So I want you to just sort of react to the comments that are made, people saying, we stayed away from our loved ones. From my host, Greg Brady, who said that, his father-in-law is in a nursing home. He can't visit because he's one of the people who's allowed to go visit. And, it's one thing to make a mistake, but it's another thing to try and cover it up. So your reaction to those comments, Your Worship?
Well, whatever the elements are of the mistake, I said it was regrettable. The whole thing is regrettable because it also gets us into the realm here of people in public life and in public office who are expected to set an example, all being called into question because of what's happened here. So it's regrettable, and it was a big mistake, and I can't speak to all the elements of it because I'm not familiar with them. I just know that he was in a place where he shouldn't have been, and he's acknowledged that. and he's coming home to get back to work. So, you know, I'm not defending any of the actions. I'm defending the human being who I know, who's been a good partner for Toronto, and the whole matter is now in the hands of the Premier and Mr. Phillips, and they'll deal with it accordingly. But it's just regrettable in every single respect, and there's nothing more to be added, I don't think.
Well, if I could, what do you make about the social media posts that made it look like he was here for Christmas?
I haven't seen those, so I can't really comment on them, but I think at the end of the day, you know, if you look at the entire chapter taken as a whole, whatever all the elements of it may be, if Mr. Phillips had it to take back, if the Premier had it to take back, if I as a person in public life as well had it to take back from the standpoint of us all having to answer for these kinds of things, I think we'd all take it back, the whole thing. It's deeply regrettable, and it has caused a whole discussion to be taking place when in fact we should really be focused on, you know, what we can all collectively do to make sure that the numbers get better by following public health advice. So it's just completely regrettable in every respect.
Thank you. We'll go next to Alison Martel from Reuters. Alison, go ahead.
Thank you. Dr. Davila, if I understood correctly, Dr. Yaffe said yesterday that once Moderna doses arrive, public health units will take the lead in running vaccination across Ontario, beginning with long-term care. Is that your understanding?
Sorry, Alison, I think you,
You dropped off a bit.
Sorry about that. Can you hear me now?
Yes, go ahead.
Okay. Dr. Yaffe said yesterday that once the Moderna doses arrive, public health units will be taking the lead in running vaccination across the province, beginning in long-term care homes. Is that your understanding of the next step?
So, you know, with respect to your question, I can't speak to the rest of the province. I think the circumstances vary a great deal from one jurisdiction to the next. I would say this, however, when it comes to vaccination, for example, within the context of long-term care homes, there is a well-established infrastructure, certainly within long-term care homes here in Toronto, whereby staff within the long-term care homes themselves administer flu vaccine to residents. So within the context of a situation like a pandemic or an outbreak, it is generally the best practice to rely on the existing systems, such as they are, rather than trying to invent new ones. So while I think one always has to be ready to adjust and change and, you know, adapt one's response depending on what the circumstances are, I think you can expect that here within the City of Toronto that we will make the use of the existing infrastructures and the existing systems to the greatest extent possible, because that will provide for the most effective and efficient administration of COVID-19 vaccine in long-term care homes.
Thank you. How will you select the first homes for vaccination?
So there are a number of different, you know, criteria that are necessary. Clearly, you're going to want to look for, and we are looking at such things as, you know, is there an active outbreak that's going on right now? You know, that would certainly complicate issues. So you're trying to look for those opportunities where the vaccine can be delivered most effectively and efficiently. And an outbreak will be one of those things that will certainly hinder the ability to deliver vaccine quickly and in an expeditious manner. Beyond that, I think part of it is making sure that the staff is ready to do so, that the infrastructure is ready, willing, and able to do so in a time frame possible, because what we're trying to do is to put vaccine into people's arms as quickly as possible. So I think there are a number of you know, different logistics concerns as well that will come into play as we work with our partners throughout the system to deliver those vaccines in the most effective and efficient manner possible.
Okay, thank you. And the final question is from Malia Sheikh, from City News. Malia, go ahead, please.
Good morning. My question for you guys is, you know, clearly people are gathering right now, and with it being New Year's Eve tomorrow, are there any plans to increase bylaw officers do checks in neighborhoods to see if there's, you know, vehicles outside of homes, because clearly people aren't getting the message and are still getting together?
Our plans coming into the New Year's Eve and New Year's Day celebrations will largely remain unchanged. As I explained before, our coordinated enforcement teams have been in place now throughout the response to COVID-19, and those procedures will continue. We will continue to receive or be made aware of public health and safety concerns via 311. Those complaints will be received, they will be triaged, if you will, or prioritized, and then our teams will respond to them on a prioritized basis. So I think our residents can expect to see the same, very similar, if not the same level of response that we've seen throughout the response to COVID-19. That's what can be expected over New Year's Eve and New Year's Day. And I just hope that we're going to see people continue to make good choices, and even increasingly so, make good choices. We would all love to be standing right here in Nathan Phillips Square enjoying a large celebration. That obviously isn't going to happen, as we heard Mayor Tory said, and for good reason. But we need to make those good choices. Our enforcement teams will be engaged and will respond on an as-required basis alongside, of course, MLS, Municipal Licensing and Standards, Toronto Public Health, and Toronto Police.
Follow-up, Malia? You'll need to unmute.
Sure. What's your message to people right now who are still planning parties for tomorrow? Despite the numbers going up, they're still messaging their friends and looking to get together tomorrow.
You know, I'll try one, which is please rethink what you're doing here. And I don't know what's going to have an impact on people who are still planning parties, whether it's to think of the 78 families that are grieving the loss of a loved one over the Christmas period, or whether it's that by having such a party you put yourself at risk. I heard this week of a dinner party involving all of 4 people. And the 2 of the people there didn't know they had COVID, and by the time it was over, all 4 had tested positive. And they're putting their own health at risk. Even young people, you know, I've learned from our doctor and all the other doctors you listen to, face a lifetime potentially of serious health hazards and risks that will be with them for a long time, even if they don't end up getting hospitalized. So just reconsider that. My wife Barb would tell you that I've always thought New Year's Eve was overrated anyway, and people should just, you know, chill out, stay home with the people that they live with, and there's lots of good stuff that's going to be available to celebrate New Year's on television, including from right here at City Hall, virtually, and from the CN Tower and from Ontario Place. And please, think of other people. If you don't want to think of yourself, which you should, think of other people and think of the damage that you can do, just even one person, by going somewhere they shouldn't be is potentially doing damage to the health of many, many others.
Okay, thank you very much. That concludes today's briefing. Wishing you all a very healthy and safe 2021. Happy New Year, everybody. We'll be back here on January the 4th.